a demonstration of a Foley catheter insertion for a female, sometimes called a retention catheter. I have done my standard steps, identified my patient, introduced myself, and the first thing I'm going to do is, and I have all my equipment set up, the first thing I'm going to do is find the meatus on a female, because that can sometimes be very challenging. And I'm also going to do pericare so that this perineal area is clean prior to my insertion. I have her draped with what I call a diamond drape so we can lift this up, and yet she's still pretty well covered. So I will have a flashlight and find the meatus, which is very easy to find on this mannequin. And then I will do pericare, which will be soap and water, rinse, and dry the area before I begin. I have my Foley cath kit, which is self-contained. Sometimes this will come in pieces with the catheter drainage bag separate, the catheter separate, and the insertion kit separate. But we have all in one right here. I'm going to take the bag from the box and put it at the foot of my bed, and this will collect my discards. The next thing, I'm going to take my clean gloves off now, and I would sanitize my hands. And this I do not need. That just lists all the equipment that is in my kit. And I am going to show you a couple ways to open this. One way to use your kit with the female, and another way to use it with the male. So I am going to open this with the flap away from me first. And I'm doing that because even though I cross over my field, I still have sterility here, and my sterile field is still covered up. If you do pinch, you contaminate only the bottom, so I suggest that you do pinch when you open this up. And what now is on top is my gloves. So I can take my gloves off, and I need to find a place not over my sterile field to set these up. And although my bed's a little bit lower, this is than my waist, this is as high as my bed will go. Open my package and step up and away. You can laugh now. And up and away. And what I have here is a sterile drape, and I will put that down for my field. And as I lay this down, I want to protect my hand, my sterile gloves, because I have my sterile gloves on. So I'm not going to do too much adjusting when I do that. And the next thing I have is called a fenestrated drape, and you may use this or not use it, but I would not discard it. And for a female, this is nice because it and a male, it increases the size of your sterile field. So I will place this, and again, I'm not going to do an awful lot of adjusting to keep that in place. Now I'm going to get my kit ready to use, and this kit happens to have a couple pieces. They're all set up in a little different way. So at this point, I'm going to bring this over so I can open up my sterile field. When I set this down, I don't want to contaminate my sterile gloves. And I will move this forward. And now I'm going to work within this field in order to establish sterility. So this is all sterile. My gloves are sterile, so I can be comfortable doing this. I'm going to open up my cotton swabs that I will use to clean this perineal area. Sometimes these are betadine, and for the purposes of use on our mannequin, we are going to use simulated swabs. I will open up my lubricant for my catheter, and this is sometimes a bit of a challenge. And in this case, it's going to be a challenge. Hello. This will want it open enough because I'm going to put my catheter in there. And then I want to test the balloon on my catheter. So I will pull this out. And did I contaminate the tip of that catheter? If it
hit the box.
The outside, yeah, the outside of that box would have still been sterile, so I'm okay. I like to leave the rest of the bag right in the box so it's not getting in my way. I have my solution for my balloon. I'm going to hold on to this and keep it closed so it's not flopping around. I will insert all of this solution. It's not often that these break, but I have had it happen once in 1,000 catheter insertions. And I'm just going to leave this attached. So my balloon is intact. I am going to put my catheter right in my lubricant. You can spread it, however. And these fell off my sterile field, so I'm going to be careful to touch them just here where they are sterile. When I drop things into my bag, I'm going to drop them from up high. So I'm now going to take my non-dominant hand and spread the labia. And you just have to get used to this being a challenge for your hands sometimes. If this is a moist area in your client, you can use a washcloth to hold the labia open. But once you start cleaning, you can't let the labia fall back or you've now contaminated the meatus. So I'm going to start from the far side, one swipe down inside the labia, another swipe on this side, and a third swipe right down the middle on the meatus. I'm now ready to insert my catheter, and I'm going to insert it 2 to 3 inches, and then once I see urine, which I'm now simulating that I see, I'm going to insert it another inch to 1.5 inches. I have a choice now to drop my hand down and hold that catheter. If I do that, it does contaminate the catheter, or if I'm pretty sure it's going to stay in the position where I put it, I'll go ahead and insert my fluid. And I've got to hold this plunger in or that fluid's going to come right back at me. Now I can drop my hand down and pull here, drop it down the rest of the way, and disconnect this. I'm now done with the sterile part of my procedure. And prior to this, this woman can now move her legs down from lithotomy position. We can make her a little more comfortable. And I've completed this part, so this can now be discarded. And and this fenestrated drape just gets ripped off now. I put my catheter strap holder on prior to starting this. With these particular catheter straps, it goes right up at the Y port and comes through to hold this in place. And this will come over the leg and hang on a non-movable part of the bed. I would suggest that you always check these to be sure the valve at the bottom where we empty the catheter is closed. And my next step will be to do pericare because I may have betadine on the labia, and that's a little startling, so I'm going to wash and clean and dry and then make my client comfortable. So, Miss Nightingale, that is done.